Snorkeling with glaucoma, benefits and cautions. Snorkeling is a popular, low-impact water activity that many people enjoy. For someone with glaucoma, an eye condition often related to high intraocular pressure, IOP, and peripheral vision loss, snorkeling may seem worrisome. In fact, snorkeling involves shallow swimming at the water's surface with minimal exertion. This means it generally causes little change in eye pressure, IOP. In contrast, deep scuba diving significantly increases pressure on the body. Research shows that diving masks, like those used for snorkeling, do not raise IOP. In one study, putting on a standard diving mask actually lowered IOP slightly. By contrast, tight swimming goggles can squeeze around the eyes and temporarily raise IOP. In practice, wearing a well-fitted snorkel mask with a nose pocket tends to spread pressure evenly and is safer for glaucoma than snug swim goggles. Importantly, snorkeling is mostly done at the surface, where the water pressure is nearly the same as on land, so you avoid the pressure changes of deep diving. As long as you stay at shallow depth, you typically won't encounter the mask squeeze injuries, like bleeding in the eye, that can happen when divers descend without exhaling through the nose to equalize pressure. So for surface snorkeling, mask pressure effects are minimal. Benefits of snorkeling as gentle exercise. Snorkeling provides light aerobic exercise comparable to swimming, walking, or mild jogging. Exercise has well-known health benefits, and studies suggest it can be good for glaucoma patients too. Regular moderate exercise tends to lower IOP and improve blood flow in the eyes. For example, research finds that people who meet physical activity guidelines have a lower risk of developing glaucoma. And aerobic workouts, like swimming, can reduce eye pressure and even expand drainage channels in the eyes. In practical terms, spending time snorkeling gets your heart rate up without hard impact on the body. Besides physical fitness, snorkeling can be relaxing and mentally refreshing. Being immersed in water and watching underwater life often reduces stress and anxiety, which is healthy for the body and eyes. Studies and expert opinions note that swimming-based activities, like snorkeling, improve mental well-being, releasing tension and boosting mood. In short, for many glaucoma patients, snorkeling offers a safe, low-pressure workout. It raises the heart rate gently, but does not involve straining or inverted poses that spike IOP. Potential eye risks from snorkeling. While snorkeling is mild, there are some considerations to keep eyes healthy. Mask pressure. A snorkeling mask that fits properly should not sharply increase IOP. Use a diving-style mask that covers both eyes and the nose together, rather than separate swim goggles. These larger masks distribute pressure and include a nose pocket, making it easier to equalize if you dive down. In one study, wearing a diving mask did not raise IOP. In fact, IOP slightly decreased. By contrast, very tight small swim goggles can raise IOP by about 4 to 5 mmHg while worn, although this effect is usually temporary. The bottom line? Pick a comfortable mask and don't over-tighten the straps. If you do dive a bit underwater, exhale gently through your nose to equalize pressure and avoid any squeeze-related injuries. Saltwater irritation. Ocean water contains salt and microscopic particles that can dry out or irritate the eyes. Salt can strip away your natural tear film, causing stinging or gritty sensations. If seawater splashes under your mask or you open your eyes underwater, you might feel dryness or mild pain. Furthermore, natural waters can harbor bacteria or parasites like Pseudomonas or Acanthamoeba that may infect the eyes if contaminated water gets inside. To protect your eyes, keep your mask sealed. A good mask with a secure skirt will keep water out. Avoid rubbing your eyes after snorkeling and rinse with clean, not seawater, eyes drops if they feel irritated. Also, never snorkel in contact lenses without proper goggles. Trapped water under a lens can lead to serious infections. UV exposure and glare. Snorkelers can be exposed to intense sunlight. Water reflects sunlight, adding UV rays from below as well as above. Even on a cloudy day, reflected UVA and UVB from the water's surface can be strong. Prolonged UV exposure is linked to eye problems like photokeratitis, a painful sunburn of the cornea, cataract formation, or growths on the eye surface, pterygium. In fact, experts note that people who spend a lot of time in water sports have a high risk of UV-related eye damage. To guard against this, use protective measures. Apply broad-spectrum sunscreen on exposed skin, wear a hat or rash guard when near the water, and use polarized or UV-blocking eyewear. Many modern snorkeling masks come with special lenses that cut UV rays. Some UV diving masks block over 98% of harmful UV light. These lenses also reduce glare, making it easier to see underwater. If your snorkel mask does not have UV protection, consider wearing a hat with a brim when not snorkeling or lounging under shade between swims. Glare and contrast. Sunny reflections off the water can also make it hard to see clearly. Masks with tinted, polarized, or anti-glare lenses improve visibility by reducing the bright reflections on the water's surface. For example, dive masks with specialized coatings improve clarity and color perception underwater. In bright tropical waters, a mask with a slight tint, red or pink, can actually restore lost colors at depth, while yellow tint works in low light conditions. Choose a mask lens color that matches your typical snorkeling environment, and look for anti-fog coatings as well. Limited peripheral vision. Glaucoma often narrows peripheral side vision. In open water, that could be a hazard if you can't see things coming from the side, like currents, boats, or other snorkelers. To be safe, snorkel in conditions where water is calm and clear. Avoid strong currents or heavy waves that could sweep you unexpectedly. It's wise to snorkel with a buddy or in a guided group, so someone else can watch your back. If your peripheral vision is significantly impaired, use a mask with a wider field of view glass and practice turning your head gently to compensate for blind spots. Always stay aware of your surroundings and prefer shallow reefs or lagoons where you can stand if needed. Choosing snorkeling gear. Snorkel mask. Pick a mask that fits your face snugly but not tightly. A low-volume or frameless mask with close-set lenses can reduce the air gap and make clearing water easier. Ensure the silicone skirt seals evenly around your face. Adjust the strap so it's snug but not digging in. The mask should have a nose pocket for equalizing pressure if diving slightly. Some masks have anti-fog or hydrophobic coatings. These help eye comfort. As noted, diving-style masks are preferred over swim goggles for people with glaucoma. Lens type. For sunny conditions, use a mask with UV protection or polarized lenses. Many reputable dive mask brands now offer UV-cut glass that blocks most UVA/UVB rays. Polarized lenses, like mirrored or tinted masks, cut surface glare and can reduce eye strain. If you snorkel in cloudy or low-light water, a clear lens might be better to maximize light. Snorkel. A sturdy snorkel tube with a splash guard valve will keep water out. Make sure the snorkel is attached properly so it doesn't press on your face or eyes. Fit and comfort. Look for masks with adjustable straps and comfortable nose pockets. Avoid too tight straps that squeeze around the orbital bones. The mounting strap tension should be gentle, just enough to hold seal. Some masks come in different shapes for men, women, or children. Try a few to find one that feels right. A well-fitting mask will minimize leakage, so salt water doesn't enter the eyes and won't press hard on your face. Sun protection and hydration. Even though you're in water, you can still get sunburned and dehydrated. Drink plenty of water before, during, and after snorkeling. Staying hydrated keeps your eyes moister and can help prevent headaches or fatigue. Reapply water-resistant sunscreen frequently, covering forehead, nose, and cheeks. Wear UV protective reef shirts or rash guards to block sun, and consider wide-brimmed hats or UV-blocking sunglasses when out of the water. Remember that taking a break in shade helps your eyes recover from glare. Suitability and safety precautions. Snorkeling is careful exercise and fun for many people with stable glaucoma, but there are safety tips to keep in mind. Consult your doctor. If your glaucoma is severe, unstable, or you've had recent surgery, like a drainage implant, check with your eye doctor before snorkeling. However, even patients with glaucoma surgery have safely used diving masks. In fact, one study suggests diving masks are a safer option than goggles for eyes after glaucoma surgery. Monitor your eyes. Stop snorkeling if you feel eye pain, blurred vision, or headache. Those could signal too much sun exposure or mask pressure. Avoid depth. Snorkeling should stay at the surface. If you dip below, do not hold your breath or dive too deep. Equalize any mask pressure by exhaling through the nose as you go down. This prevents eye barotrauma, like red eyes or bleeding under the conjunctiva, which occurs only with substantial depth change. Buddy system. Always snorkel with a companion who knows about your vision limitations. They can alert you to hazards outside your field of view. Safe environment. Choose calm, familiar snorkeling spots with clear visibility. Avoid areas with strong currents, surge, or boat traffic. Wear bright swimwear or a snorkel vest if currents are present, so you stay visible. Equipment familiarity. Practice breathing slowly through the snorkel while floating face down in a pool or shallow water first. Make sure you're comfortable clearing the snorkel, blowing out any water before heading into open water. Conclusion. For most people with glaucoma, snorkeling is a safe and enjoyable activity with proper precautions. It offers gentle aerobic exercise and stress relief without heavy strain on the eyes. By choosing a comfortable diving mask, avoiding tight swim goggles, staying hydrated, and protecting against sun and salt water, you can help keep your eyes healthy. Avoid diving deep and be mindful of your remaining peripheral vision. With these safety measures, snorkeling can be a relaxing way to stay active and enjoy nature even with glaucoma. All links to sources are available in the text version of this article. You can find the full article at visualfieldtest.com. Thanks for listening. To check your visual field, click the link at the bottom of this article or visit visualfieldtest.com.